The target audience for this presentation is for nurses and interdisciplinary care team that interacts and provide care for this population. And the presentation is conducted at an education forum at an orthopedic and spine center. What is scoliosis? Scoliosis is defined as a lateral curvature of the spine. Deviation of the spine greater than 10 degrees in the coronal plane. The curvature starts at the lower back to form a S or a C shape. Scoliosis causes the ligaments of the spine to become brittle and weak. The disease process affects about 2% of the general population. In order to understand scoliosis symptoms and treatment choices, let's start with some understanding of the general anatomy of the spine. By becoming familiar with the various parts that make up the spine and how they work together, it facilitates ease and familiarity. The spine consists of 24 small bones or vertebrae that are piled on top of each other to create the spinal column. Each vertebrae has a soft, gel-like cushion called a disc that helps absorb pressure and keeps the bones from rubbing against each other. Each vertebrae is held to the spine by other groups of connective tissues called ligaments. The ligaments connect bones to bones, while tendons connect muscles to bones. The joints in the spinal column are called facet that links the vertebrae together to give them the flexibility to promote movement amongst each other. The stacking of the vertebrae on top of each other creates a hollow tube that anchors and protects the whole spinal cord and its surrounding nerve roots. As the nerve roots branches off to exit the spine through spaces called neural foramina into segments of the body such as the cervical spine, the neck, the thoracic spine, the chest, and the lumbar spine, which is the back, and the sacrum that connects the spine to the pelvis region. A normal spine is viewed as an S-like curve. When looking at it from the side, which allows for an even distribution of weight and aid in all kinds of stress, the cervical and lumbar spine have an inward curve while the thoracic spine curves outward. Each portion or segment of this musculoskeletal system relies on each other's strengths to function properly in maintaining body mass. Scoliosis can be classified. There are two major areas that are classified for the adult population. Idiopathic, which is of unknown causes, or it could be hereditary, etc., or degenerative adult scoliosis. For this presentation, the primary focus will be geared towards degenerative scoliosis as it affects age 18 to 65 years old population. Just a brief overview of the idiopathic scoliosis process. This type of scoliosis also seen in teenagers, and it is of unknown cause. It may be a genetic basis that consists of a combination of abnormal development of the bones, soft ligaments, weak muscles, or abnormalities with the inner ear and balance function. For adult degenerative scoliosis, this type of scoliosis, which is our primary focus, is a combination of age and the deterioration of the spine, which leads to the development of a scoliosis curve in the spine column. Degenerative scoliosis tends to begin after the age of 40. In older patients, particularly women, it is related to osteoporosis. The osteoporosis weakens the bone, making the bone more likely to deteriorate. The combination of these changes causes the spine to lose its ability to maintain a normal spine. Degenerative scoliosis is the second most common type of adult scoliosis. This degenerative process occurs when tissue wears away due to aging in the lower back, leading to the development of a curve in the spine. Degenerative scoliosis is a combination of age and deterioration of the spine, which leads to the development of a scoliosis curve. Again, depending on the spinal levels affected and the severity of adult scoliosis, certain physical characteristics may exist, which includes the deformity, lack of symmetry. For example, one shoulder or hip may appear higher than the other. Trunk imbalance may cause the patient to appear to be listing to one side, or leg length. Um, this picture is just an overview, just showing what the normal spine appearance should be like, and when the patient has scoliosis, how it appears to be viewed from X-ray, from the radiographic picture. So scoliosis affects the entire body system. It affects the hematopoietic and cardiovascular function, respiratory, fluid, electrolytes and urinary functions, reproductive and endocrine functions, gastrointestinal, musculoskeletal, neurosensory functions, integumentary and body defense function. The respiratory function is also impaired as a result of scoliosis process. Um, the respiratory system is responsible for providing vital oxygen and remove toxic carbon dioxide from the act of breathing. The system of gas exchange consists of two major divisions: air conducting and gas exchange system. As we breathe, this allows for the exchange between oxygen and carbon dioxide gases to occur. Worsening scoliosis through the increased sideways curvature of the spine significantly alters the shape of the thoracic cage and diaphragm. This limitation causes a decrease in vital capacity. Fluid and electrolytes and urinary function is also affected. Fluid within the body are distributed among functional compartments or spaces and provide a transport medium for cellular and tissue function. Fluid fluctuation will affect blood volume and cellular function. Disturbances in these functions are common and can be life-threatening. Fluid intake should equal the amount that is lost. When fluids become excessive, it accumulates in the interstitial space, intracellular and intravascular spaces, and creates pathological changes. For patients suffering from scoliosis, fluid accumulation will cause edema and fluid shifts to affect the cardiovascular and respiratory system, as well as other vital organs such as the urinary system, which helps to regulate volume. The reproductive and endocrine system is also affected by this disorder. The abnormalities in the structure and function of the reproductive and endocrine system in patients with idiopathic and degenerative scoliosis signals reason to investigate. These systems are responsible for multiple bodily functions. The reproductive system in males and females are responsible for their procreation and hormone balance. And for this population, if their system is impaired, maintaining a good reproductive health can decrease the likelihood of issues within the system. Women who have been successfully treated for scoliosis have only minor or no additional risk at all for complications during pregnancy and delivery. A history of scoliosis does not endanger the child. Like the reproductive system, the endocrine system is responsible for producing and secreting a wide range of hormones and chemical transmitters to aid in the regulation of the body's growth and development, meta- metabolic changes, sexual and reproductive functions. The endocrine system is responsible for hormones that are necessary for a variety of processes. In scoliosis patients, the endocrine system is known to secrete hormones such as calmodulin, which is a calcium-binding receptor protein that regulates the contractile properties of the muscles and platelets. When calmodulin levels are increased in platelets, they've shown to be associated with worsening of scoliosis disease. The gastrointestinal system is also affected by this disorder as well. The gastrointestinal system is responsible for multiple functions of the body. It is because of this system that the body is able to perform functions such as ingestion, absorption, and elimination of waste products. For scoliosis patient, as the symptoms and deformity become severe, it alters the body functioning as well by causing suffering from pain, trouble walking, and numbness in the body, breathing troubles, and digestive problems. Regardless of the pathogenesis, GI disorders often create short or long-term nutritional deficits or elimination issues that can affect the individual overall health. The musculoskeletal function, which is the major system that is affected by this disorder and plays an essential role in facilitating locomotion and balancing. This system also gives the human body form and stability while protecting the body's vital organs. The musculoskeletal system is responsible for assisting in homeostasis as well as hematopoiesis. In scoliosis patient, the impairment affects the musculoskeletal function by inducing perturbations to standing balance because the vertebral column is deformed at the thoracic level as well as the lumbar level, which affects the severity and progressiveness. Scoliosis impedes on the movement of the ribs, places the respiratory muscle at a mechanical disadvantage, and displaces various organs of the thoracic cavity. The neurosensory function is seen to be experiencing deficits from this disorder as well. The nervous system, which is central in controlling many of the body's function, it collaborates with the muscles, organs, and glands to regulate heart rate, blood flow, breathing, and digestion. The nervous system helps the body to get rid of waste products such as urination and defecation. If the nervous system works with other systems to maintain homeostasis by receiving and responding to input from the environment, when this is impaired, then all these functions are altered. The sensory system functions like a surveillance system. That system changes in the internal and external environment. The sensory function responds to various internal and external stimuli and alerts the body when something is going to happen or if there is presence of an immediate danger. For patients with scoliosis disease, the vertebral column houses a multifaceted sensory response system. Every aspect of movement, form, and function. This ability allows the sensory system to detect deformity of the spine and translate it into a diverse pathological consequences. Normal human spine is programmed to assume a wide range of positions including curvatures to the left or right in response to stimuli. In scoliosis patient, the functional curvature becomes habitual by conforming to a lateral position secondary to induced stress, pain, or injury that was never treated appropriately, and as a result, the deformity may become permanent unless surgically corrected. The progression of curve is supported by osteoporosis, particularly in the mid-40s to 65 years old in postmenopausal female patients. These patients present themselves predominantly with back pain, then leg pain, and claudication symptoms, but rarely with neurological deficits. The skin and body defense. How does the integumentary and body defense work with other systems? The integumentary system consists of the skin, hair, nail, glands, and nerves. This system helps the body to act as a barrier or defense mechanism to protect it from the external environment. It is this system that functions to retain body fluids, protect against disease, eliminate waste product, and help in regulating thermal environment. Scoliosis patient first line of defense is the skin and mucous membrane. Like the integumentary and body defense system, the spinal column gives the body structure and support. It allows you to move about freely to bend with flexibility. The spine is also designed to protect your spinal cord. The spinal cord is a column of nerves that connects your brain with the rest of your body, allowing you to control your movements. Without a spinal cord, you could not move any part of your body, and your organs could not function. This is why keeping your spine healthy is vital in living and sustaining an active life. Here I present a concept map. The concept map is designed to illustrate how the disorder affects a particular population and modifiable and non-modifiable factors which can influence the progression or maintain current status. So here we've seen that the disease process seemed to be more prevalent um, with Caucasian. Cobb angle in the studies done where they measured the Cobb angle greater than 10 degrees. 263 patients of 2,973 subjects were examined. 11% were Caucasian compared to 6.5% African American. Adult scoliosis are common amongst this population. So the effects of modifiable and non-modifiable changes, as we can see here, that the curve progression is not modifiable. Maintaining progression with diet, exercise, sleep, and conservative therapy is modifiable to enhance quality of life and preserve good health. So to continue, the disease process most commonly affects female. In older patients, particularly women, it is also often related to osteoporosis, which is a process that weakens the bone, making it more likely to deteriorate. In a study done by Dr. Cindy Walker in 2003, she discovered that many patients had long-term psychological impact associated with scoliosis treatment. Some of the symptoms and chronic conditions that resulted from this study was body image disturbances, poor coping mechanisms were identified. Female experience more emotional distress, discomfort during physical activities, anxiety, fear, and social withdrawal. The male counterpart or male patient with scoliosis reported they were less healthy. Body image disturbance was of significant concern, suicidal ideation, decreased peer relationship, as well as increased alcohol consumption. So, management and therapy for this population, um, early detection is crucial. The lower the risk for surgical procedure, the more the most important problem associated with scoliosis is the rate of progression and the collateral effects. Factors that influence the effects are the growth potential of the patient, magnitude of the curve, says curves greater than 10, minimal non-invasive procedure, curves that are 40 degrees or greater. They're more in tune to have some kind of surgical interventions to correct the progression. The sex of the patient also is a significant underlier. Women are more likely than men to have increased progression. It is usually diagnosed with radiological methods along with physical examination to allow for a good indication. Treatment is individualized. Curves greater than 10 degrees may not require active treatment, and a non-surgical approach is recommended. Exercise and physiotherapy can be administered to improve posture and strengthen the muscles. Orthotic treatment may be necessary to correct posture, such as braces. And again, very large curvatures will require surgical interventions. Physical activities are recommended to help strengthen the muscles. Yoga, weightlifting, aerobic, and stretching activities are some of the physical exercises that can be done to help alleviate progression. Join in support group to help cope with the disorder. Also help many patients to overcome some of the stigmatism or some of the fear in which they experience from just not feeling as normal or don't think they are normal because of the disease process. So a recommendation to seek psychotherapy for depression or mood swing deficits to help alleviate the fears and concerns, and utilization of the internet. The internet is an excellent source because you can find lots of information. You can join support group. The American Scoliosis Society is one of the major groups that provides all kinds of coping strategies, suggestions, interaction with other members that are undergoing similar experience, and they can share how they deal with coping with this disorder. So to conclude, scoliosis disease, it is not a discriminative disorder. It affects all population. Degenerative process such as osteoporosis helps to contribute to the cause, as well as other conditions such as back and spinal injury that causes decreased flexibility, which helps to progress the disorder. As the body and system adjust to the growth and development period, this population will experience significant change in each system. The severity and impact on each body system will vary based on the region affected by the disease process. Like the hematopoietic system, the cardiovascular system, which functions as a transportation of fluids to the body to maintain an internal balance. This system has a reciprocal relationship with all other systems. So, it is crucial to institute a timely identification and treatment for scoliosis disorder to ensure positive healthcare outcomes. When the two systems, cardiovascular and respiratory systems, are not functioning efficiently, then it leads to other vital organ failure, such as the respiratory system. There are several respiratory deficiencies that this population may encounter based on high degree of curvature. A decreased respiratory function is very evident because of the restriction imposed on the diaphragm and chest wall that affects the lung capacity and pulmonary clearance, thus presents a high risk for cardiopulmonary compromise. And adequate management with an interdisciplinary care team with regards to the individual course helps to facilitate and promote cooperation to enhance good clinical outcomes. Once again, I would like to thank everyone, thank the audience for giving me the time to share with you scoliosis disease as it affects age 18 to 65, the adult population, and ways in which we can bring awareness to this population to help treat and manage their disease process. Thanks for listening. Have a wonderful day. Thank you.